Truth Show Weekly Podcast Edition. I am your host, Dr. Caleb Slater, here with Chris, representing the Everyman, and Jill, representing everybody online. This week, we're going to talk about ankles, specifically ankle sprains, how they're managed in the current medical system, what's wrong with the way they're managed, and what you can do to actually treat them the best. So, Chris, have you ever rolled your ankle?
I don't know.
Really?
I don't know. You know what I do a lot? Because I go on a lot of walks. Every day. The curb. I twist my ankle off the curb and I fall and I make a noise.
Okay.
What is that called?
Well, are you twisting? Well, I mean, it's bad balance and coordination. That's what that's called.
Yeah, my girlfriend works at a doctor's office and she sees old people. She has to ask if they've fallen that day. And I would say yes. And that's a problem when you get older.
That's a problem.
So I don't know if it's a balance issue I have, but I do tend to I feel roll my ankle in a way that it shouldn't be. And I worry that one of these days, it's actually going to cause an injury.
Is it stepping down as you're planting your foot down off the curb?
Yeah, I'm missing the curb and I'm going off the side and it turns like that.
Yeah, perfect. And so that's a normal, so yes, you do roll your ankle then.
There you go. Every man.
Every man. And look, the every man don't even know you roll your ankle.
Didn't even know it, but it's because it's never caused an actual pain.
So let's say, Jill, have you rolled your ankle?
Yeah, I used to play sports a lot, so, sometimes if you're playing basketball or something, you both go up for the ball, you land the wrong way. That was usually
Do you ever roll your ankle bad enough that you needed to go to the hospital, go to the ER, urgent care?
Not that bad, no.
Okay. So for a lot of people out there, they have. Right, you roll your ankle bad enough, it hurts, it's bruised, you're concerned that there's a fracture, so you go to the ER, you go to urgent care, you go to the hospital, and they do some imaging, which they should. They rule out a fracture. Now, what do they do for you? Have you seen friends and family? What do they do?
I would guess they subscribe you to a physical therapist.
Maybe.
I would say the Rice method.
The Rice, yeah.
Okay.
So Price, protect, rest, ice, compression, elevation. They give you crutches, they give you maybe an air cast or a splint, and they tell you not to put weight on it. This is 100% bad information, okay? So in my book, I actually tell a story about my mother who was watching our children at the time, very young, so they were 3 and 1, something like that. And she stepped off a step ladder wrong, rolled her ankle. She didn't tell us. We were at work, so she didn't want to bother us. So she went to the hospital. They did exactly what I talked about. They x-rayed her, which they should have. There wasn't a fracture. They told her, don't put weight on it. Here's crutches. Here's an air cast. I came home, my mom's basically in tears, in pain. She's significantly swollen. I mean, it's that blackish, deep purple.
Wow.
Bruising.
Okay, so that's what it looks like?
Yeah, well, it was a good, she rolled it well.
Okay.
She couldn't put weight on it. And I kind of come home and I come home from a long day of physical therapying, right? And I am because I know what I have to do, and it's harder to do it with family. But it's very easy to address. My mom the next day, put it this way, walked 5 miles. She went out on a walk, walked 5 miles. And this is the approach that should be taken in the medical system, but it's not. So what did I do? When you roll your ankle, you typically roll your ankle by putting your foot down and in.
Okay.
This taxes 2 ligaments, your ATFL and your CFL, basically a ligament on the front side of your foot and on the side of your foot. Okay? A ligament is a stop motion. Okay? If you go too far outside the normal range, your ligaments are what stops you from going even further. If you didn't have these ligaments, possibly now you can separate your ankle, or possibly you can get your bones to collide, causing more of a fracture or bone bruise or something. So your ligaments, specifically in the ankle, your ligaments are a stop of motion. If you go past this, if you stretch them too much, if your muscles can't control the movement, you tax the ligaments, and now you sprain the ligaments, right? You can actually tear them. They're graded tears. You could fully tear them. However, if you aren't going into this range, so if your foot isn't going down and in, you aren't taxing these ligaments. Any other motion of the foot is actually okay. Doesn't stretch the ligaments, doesn't stretch the area that you had just injured, and actually will make your foot feel better. So it's pretty simple. If going down and in caused the injury and is what would stretch or tax these ligaments, go up and out. And you can kind of picture like a balloon. You have a capsule in your joint, and the capsule can kind of get distended and get in the way of the joint itself. So when your foot goes down and in, you press on the inside part of the capsule, and let's just say for the way to conceptualize this, you expand the outside part of the capsule where you're injured. Well, the way to recover that is to press down on that and actually move some of that fluid material out of the way. So I took her foot and I slowly moved it back and out. It's a little bit painful, but as I was doing it, it got less and less painful, and she had more and more motion.
So let me ask you a few things. So the pain, you're saying it's like bruising. So is the pain actually caused, is it like the effects of doing that motion that was improper caused pain and bruising elsewhere, and that's where the actual pain's coming from, and not like a structural thing?
What is structural? So it's a ligament. So when you roll your ankle, not only do you sprain those ligaments, so you can actually tear them, right? Or you can do a mild tear, you can do a full rupture. But you'll also strain the muscles, so your peroneal muscles, the muscles on the side of your leg. And if you go far enough, you'll actually pull on a nerve. So you'll pull on your fibular nerve, your peroneal nerve. And this is something that a lot of people don't know, and it's part of the recovery that I would do with patients, especially if they're having nerve-like symptoms, which would be continued pain, any type of numbness or tingling. So people don't realize that you can actually irritate a nerve when you roll your ankle. It's less common, but step one is restoring motion, and motion into going back and out. It's nice if somebody can do it passively, meaning they're moving your foot without you having to contract your muscles. If you don't have any muscle involvement, which is often the case, now once that motion's restored, now you use your muscles to bring your foot back and out. If you'd like an appointment, go to thespinaltruth.com and schedule today. We offer both in-person and telehealth appointments, and unlike the medical system, we look to the root of your problem. We look to find the cause, the why your problem, your symptoms are there in the first place, and we expect quick improvement. We expect improvement in pain, range of motion, or strength in the first visit, and 50% or more improvement in most conditions within 4 to 5 sessions. So if you're tired of being in pain, if you're tired of the medical system and its approach failing you, and you want something different, go to thespinaltruth.com and schedule today. Now let's get back to the show. This is what I had my mom do. So it took me maybe about 3 to 5 minutes to get her foot fully back, fully out, restoring that motion that she was avoiding. It took maybe another 3 to 5 minutes for me to get her to get more of a muscle contraction in that range. Then I asked her, I said, stand up. She said, no, I don't want to. And I said, I rolled my eyes, Mom, stand up. She stood up, and it actually wasn't painful. She started walking, and it actually wasn't painful. When you walk, you actually naturally move your foot back and out. So walking is pretty much okay for an ankle sprain, again, as long as there's not a fracture.
That's what I was thinking when you were saying how it's usually down and in. I was like, isn't walking just the opposite?
Walking is the opposite. Walking is actually pretty much okay for an ankle sprain and will actually make you feel better. But despite this, any urgent care, any person you go to is going to say, don't put weight on.
Right. So why do they say that? Shouldn't they know that that's how you...
They should, but this is kind of the antiquated way of addressing these sprains. And I've actually treated somebody who rolled their ankle. They were told not to put weight on it. And when you're told not to put weight on it by a doctor, by somebody at the hospital, the fear of God is put into you, right? Don't put weight on this. It's going to ruin it. It's going to hurt it worse. It's going to delay healing. But what happens is if you don't move your foot, you don't promote blood flow. Blood flow is how our tissue heals. So not only will you heal slower, not only will you be in more pain, not only will that capsule stay distended and you'll actually create a little bit of an imbalance and it'll be harder to work into, but because there wasn't blood flow, this person actually ended up getting a blood clot. They were so afraid to move their leg, they got a blood clot.
Yeah, and I would say, like, as a patient, I wouldn't know for an ankle sprain. I mean, I guess you can kind of tell by the way you step on it, but I wouldn't think that going back, like, if they're saying to not move it, I'd be like, okay, like, I kind of get why a patient wouldn't want to, like your mom wouldn't want to stand up because she's like, no, they just told me not to do that.
Right. They said don't do it, and I had to undo that. I had to undo that information, and still in her head, she's like, is he right? There's that trust there.
So say I roll my ankle, I go to the doctor, they put something on it, they say don't put weight on it, rest it. How long does recovery look like?
I mean, I would literally, if there's not a fracture, okay, I would say no to the cast. I would say no to the crutches. I would walk out.
But I'm saying I didn't do any of that. I'm listening to this doctor. How long am I taking to get better?
All right, well, how long? So they said don't put weight on it. Your next question should be for how long? What do you think they're going to say?
A week.
Okay, yeah. Now you haven't put weight on your foot for a week. You've been afraid to move your foot for a week. Now when you go to use that foot, when you start putting weight on it, how do you think it's going to feel?
Very weak.
Significantly worse.
Yeah.
It's going to feel weak. It's going to be even in more pain. It's going to be stiff and rigid, and now you're fighting against that. You're fighting against a week of inactivity that you didn't need, by the way.
But now they're like, now you need to
recover. So now you need to go to physical therapy. Now that physical therapy, I mean, it kind of depends, but you're talking anywhere from 2 to 8 weeks.
Jeez.
And this is something that is very, very simple to do. And for the people listening to this out there, if you go to our TikTok, if you go to the ankle sprains playlist, you can hear a lot of the same information, but you can actually see what I'm talking about. You can see what I'm saying to do. And I've actually had a lot of people reach out saying, this helps so much. I was able to walk right away after this. This took the pain away. And it should be the norm. It should be the approach. And here's the other thing too. So when you go to a physical therapist, so neither of you have been to a physical therapist for an ankle sprain, one of the first things they do, sadly, is tell you to do the ABCs. So you use your foot like it's a pen, and you draw in the air A, B, and why is this wrong? Is because most of the motion is putting your foot down and in. You're taxing the same ligaments that you're trying to let heal.
What if those ligaments are torn?
So, all right. So this is the way I answered this question. So let's say they're fully torn.
Yeah.
For even elite athletes, they don't do anything for it. Remember, it's just a stop of motion. And there's other things that will stop that motion, muscle contraction, joint position, stuff like that. It is just, and most of the time you don't tear both of those ligaments, so the ATFL and the CFL. It's just a stop of motion, so as long as you don't roll your ankle again, you're fine. Don't roll your ankle. Even if you did roll your ankle and you didn't have those ligaments, you'd have to roll it pretty severely, and rolling it severely, maybe to separate for a second, you'd be more likely to get a bone bruise, you'd be more likely to get a fracture of, it's called your malleoli, so a fracture of your ankle bones. But it also still is not necessarily likely. It's not necessarily going to happen. And again, for these elite athletes, if you fully tear this ligament, very likely they will not repair it.
Will those ligaments ever heal?
No.
Okay. And is there a surgery that can fix them if they're torn?
Yeah, absolutely. But it's almost not worth it.
Gotcha.
So, not to be like hyperbolic, but out of all the stuff in your body, this ligament is pretty unimportant. So your ACL, right?
Yeah.
Your ACL, everybody knows what your ACL is. You can squat, you can run, you can do a lot of stuff with your ACL, okay? You can squat with weight, you can walk, you can run, you can go up and down stairs, you can jump, you can land. The one thing you can't do that's hard with your ACL is cut, lateral movement. So if you're just the everyday person, if you just want to wake up and go for your morning walks, go on hikes, stuff like that, you don't need your ACL. For these ankle ligaments, it's the same thing, except you can cut, you can run, you can jump, you can sprint, you can do everything you want.
Roll.
You just can't roll your ankle. It's really the only motion that they are used in. So again, you go to a physical therapist and they have you do something called ABCs, and they have you do something called an ankle four-way. And for the people out there, if you go to a physical therapist for your ankle and they have you do ABCs, find a new therapist. You need a new therapist. That therapist sucks. When they have you do an ankle four-way, they put a TheraBand around your foot, around your forefoot, and they have you do resistance into the 4 planes. They have you do resistance back, down, in, and out. Well, 2 of those motions aggravate your injury. Why do that?
I don't know.
Why would you do that, Chris?
I don't know. I don't know. I wouldn't.
So it's very frustrating because I see this all the time. And again, as soon as you've rolled out a fracture, start moving your foot back. start moving your foot back and out, start contracting the muscles in that range, and then walk.
Is there how do people typically roll their ankles? Is it a sports injury typically?
No, I actually hear that stepping off of a curb is pretty common. No, honestly, so stepping wrong is if you walk on grass, it's uneven surfaces. Sports obviously are basketball, soccer are big ones.
Yeah, it says basketball, American football, and soccer have the highest incidence of ankle sprains. And then it says...
I would guess basketball from the jumping.
Jumping and landing on, stepping on other people's feet.
And you're running a lot, and you're kind of running like you stop and then go a different way too, so that's definitely a way you could do it. It does say that kids are more likely just because they're clumsy.
I was just going to say having kids makes you roll your ankle.
Yeah.
Because you're going to step on the crap that they didn't pick up. Yeah, that Lego is going to roll your ankle. So there's a lot of ways to roll your ankle, but it's all pretty much the same. It's the same ligament that's involved, the same pretty much unimportant ligament. And as long as there's not a fracture, start doing what I'm talking about. See how it does.
So is that like the only ankle injury really you can get?
No, I mean, there's a bunch.
Okay.
Ankle sprains take up 40% of all ankle injuries.
And what is an ankle sprain?
You stress the ligament.
The ligament.
Yeah, so it's the ATFL or the CFL, and then there's the muscles, right?
Okay.
You can sprain the muscles, so you overstretch the muscles. It's kind of like a whiplash injury to the muscles.
And so that's the same recovery as what you're suggesting?
It can be a little bit different, because if you've significantly torn the muscles, now you actually do need to do a little bit of preservation of the muscles. Like, you have to let them heal.
Okay.
It depends on how bad they're torn, but you can do some slight contraction, but you don't want to contract hard. You still want to restore the motion of the foot. That'll actually make you feel better. You can walk, but you don't want to strongly resist those muscles.
Okay.
And then finally, like I said, when you roll your ankle, nobody thinks of it like this, but you actually stretch your nerve. You stretch your common peroneal nerve, so it's a nerve that bifurcates up by your knee, goes down into your ankle. If I stretch a nerve, it's a brachial plexus, it's a traction injury to a nerve. So a burner or stinger in football is a forceful separation of your head and shoulders. It's a traction injury to your nerve. You'll get pain, numbness, tingling, weakness, basically like paralysis temporarily, but it normally is recovered within seconds to minutes, if not hours.
Okay.
Same thing happens to your ankle, but nobody looks at it like this. So if you're still having like pretty significant pain, if you're still like your motion's restored, you can contract the foot, the muscles well, but it's still pain, and it's still pain outside that recovery time, likely you have a traction injury to that never was recovered, was never treated. And one of the ways to treat this, I know it sounds odd, but would be to the correlating area of the spine. So that nerve, the fibular nerve, is a branch of the sciatic nerve. Sciatic nerves come from the lower portion of your lower back. So for a lot of people that have continued pain out there, and it should be more like nerve-like pain. Again, numbness and tingling, absolutely, but kind of that pain where it's sensitive to touch, it's sharper, it doesn't feel like your normal muscle soreness. That's the pain that, if it's lingering, it could be a nerve issue.
If you were like a runner or a hiker or something like that, are you prone to getting more ankle injuries?
No.
Okay. I didn't know if because of the way you're like maybe the footwear you're wearing, or like for me, like hiking seems like it would be
terrain. If you're walking on uneven surfaces, right?
Yeah.
One of the biggest predicting factors for an ankle sprain, you ready? Mm-hmm. Is a previous history of ankle sprains. Part of that is your ligaments act like mechanoreceptors, so they tell your brain where your body is in space. So you're basically literally clumsier, okay? The other part of that is that they're not properly recovered. You've lost a little bit of motion. So if it's harder for me to get my foot back, if it's literally harder for me to step, if I don't have that motion, I can't do it as much. I'm gonna clip my toe a little bit more, right? Okay. I'm gonna be I'm less than, right? My ankle doesn't move as well, it's harder to contract, it's stiff, there's something in the way, the muscles have to work harder, and I don't have that telling me where my body is in space. So I'm now weaker, stiffer, and less feeling of sensation, yeah, I'm going to roll my ankle more. I'm more likely to roll my ankle.
Probably me.
So
Probably,
would,
yeah.
would you say for people, like if they sprain their ankle, does it matter? Like, would it be better to walk on an incline because you're kind of like forcing your foot to be up?
You probably just want to walk.
Just regular flat?
Walk, but there's certain ways to mobilize your ankle. One great way is to put your foot up on a step and just start bringing your knee over your toe. That'll mobilize your foot into that position. It's a nice passive way of doing that. And I don't know if I show it on that video.
What about too, because one comment I've seen on that video a couple times is some people had asked about using ice, which I assume is just for like the inflammation and just kind of like a...
Ice is fine temporarily within the first few days, but even then you want to promote fluid exchange. You want to promote blood flow. Blood flow is how your tissue heals. Any of your tissue, your muscles, your tendons, your ligaments, your bone. Blood flow is how it heals. So if you just have blood pooling there, okay, not circulating, and if you use anti-inflammatories, so again, anti-inflammatories, inflammation is actually a benefit to...
Right, it's like there to fix the problem.
If you just use ice, you're not getting that same circulation. So you can use ice and heat on and off, but the best way to get blood flow, blood circulating, is muscle contraction. So that's what our muscles do. Our muscles pump blood all throughout our body. They bring blood to areas. That's how they heal. So that's why a lot of these people that they're told to just rest, ice, compression, elevation, not use it, use crutches, don't put weight on it. It takes them a lot longer. They have a lot stiffer of a joint. It's more painful during the recovery, and they might not get full recovery. Immediately that day, I want to restore normal motion. If you're out there and you're in pain, if you're tired of the current medical system failing you over and over and over again, just giving you answers that numb you, pacify you to your symptoms, and are largely based on medication, injections, and surgery, and you want a different way, maybe even a better way, look for my book, The Spinal Truth, A New World of Medicine. In it, each chapter I talk about a different symptom, different condition, different body part, and how I view it a little bit differently than the current medical system, and how my treatment has helped so many people out there when they've been let down with the typical approach. This is the way I think medicine should be. This is the change in healthcare I think we deserve. So thespinaltruth.com, you can look for my book on Amazon, Kindle, Apple, and on audio.
When I rotate my ankle, is it normal to have like a popping sensation?
It's common, but it's not normal.
Interesting.
Normally that popping is the rubbing of a tendon. So another thing that these ligaments do, and there's also called retinaculum in that area, it keeps the tendons close to the body.
Okay.
So it's kind of like a tie down. So you have like a tendon going through a tie down called a retinaculum. If you stretch or tear that retinaculum, now the tendon can kind of move, and it'll move over your ankle bone. So it's either if it's on the inside, it's your medial malleoli. If it's on the outside, it's your lateral malleoli. And you can have tendons and actually a nerve that can pop over that. So it'll kind of be like a click or a clunk, kind of like a shift or a pivot.
Yeah. So say in theory you have that.
As long as it's not becoming more and more and actually aggravating, it's kind of okay.
Yeah, I don't feel anything. I just feel like that
Most
happened.
people, they just don't like the sensation, but it's not painful.
Okay.
That's okay.
Okay. And that could have been caused because of an ankle roll at one point?
Because you've rolled it in the past, so now you've torn some of the things that are supposed to hold your tendons in place.
Okay. Yeah, I'm rolling my ankle pretty much every day, it seems like.
Which is weird, because from the beginning of this episode, you didn't know if you rolled your ankle. So I mean,
Well, because I don't have any pain when I do that.
most of the time, the first time you really roll your ankle is
Yeah.
the most painful.
Okay.
Why isn't it painful after that?
Because I've already pushed everything out of the...
You've already torn everything that you're going to tear, and now you're just kind of like, you roll your ankle to the point where you just like fall over, and you're like, and you get back up, you kind of like stomp your foot a little bit, and you're good to go.
Yeah, 100%.
Yeah.
I usually make a noise to be dramatic.
Sure,
but...
right? Yeah, but so that also kind of tells you the value of these ligaments. Again, not to dramatically undervalue them, but if you had to lose something in your body, those ligaments, and it is emphasized by the fact that you've now continued to roll your ankle, and then you just get right back up.
And also, if I rotate my ankle, both of them do the popping thing.
Yeah, you've probably rolled both.
Yeah. Well, and I do feel clumsy, like you were describing. So
the other aspect of ankle recovery is balance training.
Okay.
So it is that proprioceptive, restore that ability for you to balance on uneven surfaces, move laterally, jump, land, stuff like that. That is actually one of the best ways to return to sport and to prevent future injuries. However, I would say that first you need to restore motion, full motion. Okay. Then you need to restore full strength in that range. Then you need to do balance training. This is rarely done at clinics when you go to them, at physical therapy clinics, trainers. Again, most of the approach is rest. Then when you do start moving the ankle around, it's ABCs and ankle four-way. So if this is you at home, please comment because it's so common. People need to know this. ABCs are stupid. ABCs don't do anything and they tax the structures that were injured and need to recover.
Yeah.
Ankle four-way, the same thing. You shouldn't do two of those motions. Two of those motions tax the structures that were injured and need to recover. Why do that?
I would like to know the rationale of why they do, what their rationale is behind prescribing that.
Because it's what people did in the past, right? Yeah. So it's what you were taught. You didn't use your brain to say why. You didn't ask why. You just said, this is what I was taught for ankle recovery. This is what I'm going to do.
Yeah, and I mean, I understand, like, you go and you have this pain, and they're like, well, you need to rest it because you don't want to keep pushing on the pain and making it worse. In theory, it's like the rationale there, right?
Yeah, but, all right, so you asked what is causing the pain there.
Yeah.
All right, if it is the ligaments, you moving your foot back and out actually shortens the ligaments.
Yeah, it won't hurt that.
Doesn't do anything to them.
Right.
Actually takes pressure off. If it's the joint capsule, putting pressure in that range and getting some of that fluid out of the area, same thing, will actually make it better.
Do you think it's a case of there having to be caveats to how you do those things?
Definitely. So there is some trust, right?
Yeah.
So some of it is if everybody at the ER said, yeah, you can move it, and they didn't have enough time to say, all right.
In a certain way.
Right. This way good, this way bad.
Yeah. And then you just screw it all up.
You might be better off saying, don't move it.
Yeah.
It's quicker. It's easier.
Yeah.
They're not going to injure themselves, but there are problems that are going to occur from immobility.
Yeah.
Right? So you're right. Yeah, it's probably one of those, I don't have enough time to tell you. But you know what? That being said, I've given this talk to a group of podiatrists at Jefferson. I have given this talk about you're doing it wrong. No crutches, no braces, no splint, no air cast. Get them to move it in this direction. And it took a little bit, it took about an hour of the talk and going back and forth until I kind of won them over to this line of thinking.
Yeah, I was just reading, I just saw recently Steph Curry had an ankle sprain, and it says that he limped off the court and then he was like rocking back and forth on his chair for a few minutes, and then he started to stretch it out with a resistance band. So, but it says that he has had multiple, and I think he got 2 in this game, so now it's up to like a moderate sprain. So I'm curious to see how long it would take for him to come back for his next game, because this just happened, I think, yesterday.
If you do it right, he's back tomorrow.
Yeah. So I think they said he's going to be reevaluated Friday, and he's supposed to have an MRI. But if he sprained it, why are you getting an MRI?
So they're looking for how much tissue is damaged. So they're looking for which ligaments and if there's any underlying muscle and tendon damage.
Oh, I didn't know you could see that on an MRI.
MRI is what you could see that on. An X-ray is what you would see the bone.
Fracture.
The fracture, right? And if he strained the muscles, that does actually take time to recover. Not that you can't run and use your foot, but it will be less than pro level. So you might need to wait a little bit for that.
Yeah, they said they're a little concerned for him just because he's had so many on that one ankle. So, yeah.
But again, I'd be interested to know how many. So basketball is one of the biggest, right? Right. How many basketball players have had reconstructive surgery for their ankle for just rolling it? I mean, obviously, if you fracture it, you're going to have reconstructive surgery. So it might be a hard stat to find, but let's say if you play basketball, you've rolled your ankle. You've rolled your ankle. If you've rolled your ankle, you have at least partially torn these ligaments. But like I said, you don't see a lot of people, you don't see a lot of the pros in any sport getting ankle reconstruction surgery.
Yeah, it says in the NBA, 33% of players sustain an ankle injury, and the rate of ankle sprains and strains is the highest of all injury types.
Yeah, but they're not getting surgery, they're not getting it repaired, right? So it shows you the value of this ligament in the first place.
Yeah, over half of injured players don't seek professional treatment. So they probably just rested and call it.
Well, and it's one of those things, literally walking on it makes it better. First, you should restore the motion, but regardless, literally walking on it is better, but they tell you not to walk on it. So the recovery, honestly, is just shit in the medical system for this injury. Your doctor doesn't know or doesn't have the time to tell you what to do. Your physical therapist is doing it wrong. And at the end of the day, too, let's say they have restored motion the way I said. Let's say they have restored strength the way I said. Let's say they have done balance and proprioceptive training the way I said, but you're still having pain. Nobody would look at it and think rationally, okay, if you moved your ankle too far in this direction, what are you taxing besides the muscles, the ligaments, the tendons? It's also a nerve. So you get a traction injury to the nerve, and now that nerve is pissed off. And a great way to take pressure off that nerve is to actually treat it higher up. And this is something that I do. This is something that I've done with patients and seen significant results, but it's not common knowledge, it's not common practice.
So do you think too, because I know especially in basketball, they tend to wear specific shoes that have a higher section to cover the ankle?
So you won't roll your ankle as much. It's a little bit more bracing.
Yeah. Do you think that is at all helpful, or should they be treating something higher up to avoid it?
Well, initially you treat the ankle, regardless. It's a structural issue. You need to restore motion. You need to restore strength at the ankle. And then concurrently, you can also diminish the pain by working on the back, working on the spine, the area of the nerve that's contributing to it. It might not necessarily need to be done. But that being said, if you can decrease somebody's pain, and now that because they don't have pain, they can get a better contraction, they can move more into motion, that's helpful. But nobody else out there would look at it like that. It might not be needed, but it should be looked at. You have to be careful about bracing it though too, because a brace basically does what your muscles are supposed to do.
Right, that makes sense.
Right.
Yeah.
So if you just brace it, number one, you're not getting the same motion. So, the whole motion is lotion. So if you have your ankle in a brace too much, it stiffens up. Mm-hmm. If you have your ankle in a brace, you're not using the muscles in these ranges, so you actually become kind of incompetent in outside any other range than neutral.
Gotcha.
So you got to be careful.
Sense, yeah.
So a lot of people say, should I wear a brace? As you're recovering, maybe. As you're recovering and there is still a little bit of pain, there's still a little bit of lack of motion, and you want to go back sooner to an activity, fine, but you should be working your way out of the brace.
That makes sense. That makes a lot of sense, yeah.
Yeah. All right. Anything else about ankles?
No, ankles are great.
Yeah, ankles, again, they're easy, but they're done wrong.
Yeah.
So if you're out there, if you're listening to this, go to our TikTok. Look at the ankle sprains playlist on our TikTok homepage. It'll talk you through a lot of this, but it'll actually show you what you can do for yourself. Save that page because you will sprain your ankle in the future. Save that page and you can send it to somebody who sprained their ankle. I've had so many comments about, wow, this really works. I felt better immediately. I was able to walk without pain just by doing this for yourself at home. That's our show for today. Next week, we actually have something pretty special. We have a patient that had ulcerative colitis, diagnosed with ulcerative colitis, but they probably got it wrong. Hear her journey, hear her symptoms, see if they match up with you, your friend, a loved one, because so many people out there have GI issues and they're getting labeled with stuff like ulcerative colitis, IBS, Crohn's, and it might be wrong. I treated this person only over telehealth. She lives in a different state, but despite this, we were able to take pretty much 100% of her symptoms away, get her off of medication, and restore her back to a more normal better life. Stay tuned for that. That's going to be a really interesting podcast. That's a really interesting interview that a lot of people need to hear. If you have any other questions, you can reach out to us on TikTok and Instagram, Facebook and YouTube. You can leave a comment down below or email us at info@thespinaltruth.com. Stay tuned next week. Very special interview. We will see you then.